Now, let us have another discussion about hypertension continuation. And this discussion is about the laboratory tests which are supposed to be done on a patient who is on antihypertensive or who is being treated for hypertension. There are various basic tests which should be done regularly. For example, the patient should be done hemoglobin, should be done hematocrits. So hematocrits is the volume of red blood cells, and the hematocrit is increased in dehydration. It is also increased in excessive red blood cells, and also it is reduced in anemia. Now, the normal hematocrit is 40.7 50.3% in men and around that 6.1 to 44.3% in female. It's a very important test which should always be done so that you can know the type of patient you are doing in this type of case. So again, you have to check the hemoglobin level, depending on the regions, the normal is 11.5 to 15.5. And somebody's the hemoglobin less than 11 always should be considered as an anemic, and you should also see whether you can be able to check for symptoms of anemia like tachycardia, all those type of one, because it can result to hypertension. Anemia can result to hypertension. Now, the other test which is done on a patient who are hypertensive is fasting blood glucose, and this one, the normal fasting blood glucose is 4.9 to 6.9. And if the sugar is increased more than 6.9, that means the patient is most likely at a risk of diabetes, or sometimes even patients who are dehydrated can have excessive glucose in their body. So fasting blood glucose can be reduced in if the patient is using overdose of diabetic drugs, or is most likely using, injecting themselves excessive insulin, or most likely they are not feeding well, or they are using drugs which has a long half-life in the body, like glibenclamide. So in this case, you have to be very careful when you're checking for this. Now, and the other one is that you have to check for HbA1c. The normal HbA1c is 5.7%. HbA1c checks the in pathology is that when there is excessive glucose in the body, it will get attached to the hemoglobin. And you know that the life cycle of our red blood cell is that 90 days. So that means that glucose will stay in that hemoglobin for 90 days. That's the reason why the HbA1c is important. So HbA1c is the normal is 5.7, and if the patient has a 5.7 to 6.4 HbA1c, that means that person is pre-diabetic. And the diabetic patient have 6.5, more than 6.5 is confirmed diabetics, and should be started on management of diabetes. Sometimes there may be pseudo increased HbA1c, like in excessive breakdown of muscles, or sometimes even dehydration, or even some drugs can make the patient to have a pseudo elevated HbA1c. The other type of test which should always be done on patient is lipid profile. Lipid profile, it check the cholesterol, the fat in the body, the triglycerides. There are various types of fat in the body, and these ones should be checked because they make the patient to have increased peripheral resistance, because of atherosclerosis. So the patient should be checked lipid most regularly. Low density cholesterol is high density cholesterol, triglycerides. All these ones should be checked regularly. Now, triglycerides are very common in patients who have familial hypercholesterolemia, who have familial hypercholesteremia. Who have familial hypercholesteremia. And the triglycerides should never be more than, should always be less than 1.7. And triglycerides should always be less than 1.7. So high density cholesterol is supposed to be high because it acts as a transporter and is supposed to be more than 1.1 more millimoles per liter. Then we have low density cholesterol is supposed to be low, less than 2.6. Low less than 2.6. That is also about the cholesterol in the body. So in this case, we have to be very careful about this fact, and you should be able to understand them and how to interpret those results. The other test which is very relevant in hypertensive patient is potassium and sodium. You know that potassium and sodium is related to water excretion. Potassium stays inside the cell, sodium stays outside the cell, and in the kidneys, if you excrete a lot of sodium, the patient will have water retention because of sodium retention, and this one will cause fluid overload resulting to hypertension. So that is for the purpose of electrolyte imbalance. So again, you have to check for uric acid. Uric acid is very important because it interferes with the nitrous oxide. It inhibits nitrous oxide. It is oxidative pathways. So, and also it can cause gout. It can cause kidney injuries. So it's very important also to be checked. The other one is blood creatinine. Also, the creatinine is very important because you use it to calculate the glomerular filtration rate. Another one is cysteine, which is not very common down in our place. Another one is blood calcium. Calcium, you know that cholesterol binds to calcium to make atherosclerosis. So it's also important to know about calcium. Calcium also is very important for the synovial node, and also is very important for muscles and also for bones. So it's very important to speak that. So also you should always do regular urine for microscopy. You should also do urine for microalbumin so that you can check the amount of creatinine, and also you should also be able to calculate the albumin creatinine in the urine. You can also check for any other things like infection. Other tests is like ECG and the echocardiogram are very important at least annually for the patient under management of hypertension, either pharmacologically or non-pharmacologically, so that you can be able to prevent your patient from going to what we call hypertensive cardiac diseases. And I think with that, we are done, and that means next time we'll talk something more about it. Thank you very much for listening.